Well, good morning. It's the time of year when people 65 and over are getting inundated with mailings and telephone calls about Medicare and the options they have. What's it all about? We'll talk about that and other health insurance matters coming up right now.
From TV6, this is The Ryan Report. Here's your host, Don Ryan.
Well, the health insurance coverage for many UP residents is provided by a company that was born here and continues to focus its attention on the needs of this region. That organization is the Upper Peninsula Health Plan, and the person who leads that company today is Melissa Holmquist, YouPHP President and Chief Executive Officer. She's our guest this morning. Melissa, welcome to the Ryan Report.
Hello, thank you for having me.
Nice to have you with us. So we always try to get to know our guests first, and so I know you're a UP native, right?
I am. I was born and raised here in the Upper Peninsula. I grew up in Crystal Falls, went to Forest Park High School, and graduated from there.
Okay. Anything with young Melissa that might have indicated that someday she would be a successful business executive?
I would just say that I was always interested in leadership organizations. I was active in our student council and just always excited to learn new things. I knew early on that regardless of what I did, I wanted to help people. So I'm really excited where my career path took me, and I have that opportunity to do that today.
Okay. And you went to Northern Michigan University, graduated there?
I did. I attended Northern. I received both my bachelor's and my master's degree from Northern, and I actually started working at UPHP while I was still in graduate school.
And so that's been your main job since you graduated from Northern?
It has. I was very lucky to join the company in its early years and worked my way through the organization. I've held several different jobs there. I actually started as a receptionist, so truly from the beginning through to the CEO position. So I've worked in a variety of roles in our claims department. I also worked in utilization management. I've worked with providers, our members, and our operations department as well. So I've had a great experience learning all of the different areas within the organization.
So you know everything that's going on because you've probably done it.
Enough to be dangerous, I suppose.
What is it, about 16 years you've been with them now? Or
just over 17 years.
Just over
I joined
17,
the organization in 2002.
And you've been the CEO for just over a year, I believe.
Just over a year. Dennis Smith, our longtime CEO, retired last July, so I had the great pleasure of taking over after he retired. And I worked closely with him for many years before he left.
You know, there are so many companies in the area that have UP Health or something in their name, so many health-related companies, healthcare-related companies. So tell people what the UP Health Plan is.
Sure. The UP Health Plan, we are a managed care organization, and we work primarily within government programs. So we serve the Medicaid and Medicare populations across the Upper Peninsula. One thing that's unique, we're actually owned by 12 Upper Peninsula hospitals and 1 tribal health center, so we are locally owned. We work with a network of providers, all of the hospitals across the Upper Peninsula, to provide services to the Medicaid and Medicare recipients in the Upper Peninsula. We work closely to make sure they have access to the services they need. We provide transportation to services. We have our customer service and case managers right here locally, so it is very locally providing services, working with our community organizations.
And we're not going to spend a lot of time on it, but the history is kind of interesting because it goes back about 20 years, I think.
Right. We've been in operation since 1998. When the company started, we had 6 employees. We managed the care of just less than 2,000 individuals, and obviously we've grown substantially since then. We now have over 150 employees, and we provide services and care to right around 50,000 individuals across the Upper Peninsula.
And if people don't know, you have a very nice office building in Marquette that's fairly new.
We do.
So, you know, what are the challenges that you face in your industry today with all the changes going on in healthcare?
I would say the ever-changing landscape of healthcare is something we need to continually keep up with. Our main goals and missions have never changed. Our goal is to provide access to quality services and care to members of the Upper Peninsula. We continue to be a strong voice at the state to ensure the voice of rural Michigan is heard as well. People travel long distances for services here, and we want to make sure that they continue to have access to what they need, and working with our local hospitals and providers and community organizations to make sure individuals not only have access to the medical services they need, but also community-based services such as access to adequate food, housing, and things that go beyond what you would think of traditional medical services.
And so the if someone out there is on Medicaid or the Healthy Michigan program or many of those programs, it's all pretty much coordinated through your organization.
That's true. If you're in the Upper Peninsula and you're on Medicaid, the Healthy Michigan plan, we also have a smaller population, children with special health care services. You are more than likely on the UP Health Plan. Most individuals are enrolled in a managed care company, which is what YouPHP is. And the goal there is really so that we can help individuals navigate the healthcare system. We have, again, nurses that help with care coordination. If maybe your child or a loved one have a lot of conditions and maybe they need help coordinating services. So really the goal there is to help our members as much as we can so that they have the quality of life that they deserve.
Okay. You know, one of the things that's you're involved in now too is Medicare.
Correct.
And so we're going to spend a little time talking about that today, because if you're in that age group of 65 or above, people have been getting letters and phone calls, not necessarily from your organization, but from a lot of different companies saying you have to make some choices. So why is that happening now?
Sure. Every year, Medicare has what is called the annual enrollment period, and that runs from October 15th through December 7th. So really it's a great opportunity for individuals who have Medicare or are going to be eligible for Medicare soon to learn about different options and plans that are available to them in their area. There are a lot of different types of Medicare plans, and you'll want to talk to a trusted advisor, an agent, or someone to really understand what would work best for you, because one plan may work for someone while another plan won't work for them.
Okay, we'll come back and talk more about what those options are in just a couple of minutes. Back with more on the Ryan Report after we take this break. Again, our guest this morning is Melissa Holmquist. She is the CEO of UP Health Plan. So we're talking about Medicare, and I think, you know, between the two of us, we can do kind of a Medicare 101.
Sure.
Because I'm on Medicare, my wife is going on Medicare, and you're an expert in the insurance industry. So let's just talk the basics first of all. Someone going on to Medicare for the first time, they're kind of automatically enrolled, I believe.
You'll receive a notification on how to enroll in the different Medicare programs. There are three kind of main things: Medicare Part A, Medicare Part B, and then Medicare Part D.
Well, let's talk about what they are. First
Sure.
of all, what is Part A, for example?
So Part A covers inpatient services for an individual. Part B covers outpatient services, physician services, durable medical equipment, things of that nature. And then Part D is the prescription drug coverage for an individual.
Now, as I understand it, Part A is pretty much automatic. Part B is your choice if you want it or not, and Part B you have to make a decision if you want it or not. Is that a fair way to describe it?
That is. So when an individual becomes eligible, Part A, as you mentioned, is sort of automatic. Part B, you do pay a premium for the Part B services, and someone may opt to wait to enroll. For example, if you're still employed and you have coverage through your employer, you may decide to wait until you retire before you want to start paying that premium. The other coverage is Part D coverage. You must enroll in that if you do not have any other prescription drug coverage, or you will pay a penalty. The same applies for Part B. So you really want to make sure that you understand what current coverage you have and what you may need in order to not pay some of those late enrollment penalties.
So if you decide not to take Part B at the beginning when you're first eligible and you do it later, you will pay a higher premium than you would have paid, right?
Yes, you may. There are certain times when you can elect to get it a little bit later. As I mentioned, if you're continuing to work and you've decided to wait, as long as you have some of that coverage. But yes, you're definitely going to want to check on your coverage and make sure you understand that before you elect to wait, knowing that you may have to pay a higher premium when you enroll.
So for years people had one choice. It was original Medicare. Now they have other choices in that they can go with a company like yours or several others to get that Medicare coverage. And these are called Medicare Advantage plans, I believe?
That's correct. UPHP, along with other insurers, offer plans which are called Medicare Advantage. There's a variety of different types of Medicare Advantage plans. Some just cover your medical services, your Part A and B. Others cover your medical services and your prescription drug coverage, which will then include your A, B, and C coverage. There's also standalone Part D plans that you can have if you opt for a plan that doesn't have that coverage. So there's a lot of different options available to people out there.
And as I understand it, if you go with a Medicare Advantage plan, you will still get everything that Medicare offers.
That's correct.
I mean, that you don't get less.
No, you will absolutely get all the benefits you would get through original Medicare. Sometimes some of the options you'll actually pay less through a Medicare Advantage plan. And many plans offer supplemental benefits, things like vision or dental coverage, hearing aids, or fitness benefits. So there's a lot of different types of what's called supplemental benefits that an insurance plan may offer in addition to those standard Medicare covered services.
And I did learn, reading some of the literature, that if you have a Medicare Advantage plan, you cannot have a Medigap plan.
That's correct. Medigap is another option for individuals, and that would be in addition to your original Medicare coverage. If you opt for a Medicare Advantage plan, you wouldn't have that and a Medigap plan at the same time.
And many times that Medicare Advantage plan does pick up some of those things that, not necessarily all, but that a Medigap plan might have provided.
Correct, and it's really a very individualized choice. You'll want to look at what services do you use, what types of medications are you taking, if you are taking any medications. What's important to you when you're looking at the premium cost, your out-of-pocket costs, such as a co-payment or a co-insurance amount. So I do encourage anyone who's looking at Medicare or thinking about making a change to really talk to someone who understands the different options. You can talk to an agent, maybe somebody that you've worked with. There's also an assistance program called MAP, the Medicare Medicaid Assistance Program, where you can call and also get assistance understanding the different options available in your area.
And what if people want to know more about the plans that you offer? What do they do?
If you want to know more about our plans, you can call our customer service department. You can also visit our website, youphp.com. We offer a few different Medicare plans. We offer kind of what we would call your more traditional Medicare Advantage plans with prescription drug coverage. And we also have a Medicare Medicaid plan that's specific for individuals who have both Medicare and Medicaid coverage.
And the important thing is you have to do it during this window. There are some exceptions, I know,
right,
but generally for most people. And that window is open until early December, I think.
Correct. It opened on October 15th and is open through December 7th. Again, that's the annual enrollment period. That's the time when most people will make a change. As you mentioned, there are special circumstances when you may be able to make a change at a different time. But in general, it is this time of year, and it's when you hear from a lot of different plans on different offerings that are happening in the upcoming year.
And it's really important people make good decisions here, isn't it? Because certainly as we get older, we have even a greater need for health insurance often.
Oh, absolutely. And again, it's really to understand what are your needs and what's important to you. What do you need coverage for? And again, what works for you may not work for your neighbor or for someone else. So really understanding your options.
Okay, well, I hope we cleared that up for some people, at least gave them some things to think about. We'll have some other conversation coming back just 2 minutes from now. Again, we're talking with Melissa Holmquist of YouPHP. Let's talk about YouPHP a little bit. You know, there's some different ways to measure success. And I know for the last 3 years, YouPHP is one of the top-ranked Medicare Medicaid plans in the nation based on member satisfaction. Now, where does an award like that come from?
I can tell you it's such a great award. I mean, we're very blessed and honored to receive this. So really, this is a result of a satisfaction survey that's sent out to our members. As I mentioned, we have a specific plan called the My HealthLink program, which is a Medicare Medicaid plan. And the Upper Peninsula is a region that participates as a demonstration program. And in 2016, 17, and 18, we've been a top-ranked plan as far as member satisfaction in the nation. Again, very, very proud of this award. And really, this is important more so because it's what our members are saying about us. and our providers. They're getting access to the services they need. We're helping them with the questions, making sure they have their prescription drugs that they need. And it means a lot because it's coming directly from our membership.
So it's really important, you know, to be #1 in the nation, or right up there in the top.
Absolutely.
And how are you doing this year?
Well, we did receive our scores, but unfortunately it's not out for public release yet. We did perform better than we did in prior years, so we're hopeful that we'll again be one of the top ranked plans in the nation.
And I know YouPHP is also top rated Medicaid health plan in Michigan and a top 15 plan in the nation. This comes from the National Committee for Quality Assurance?
Correct. So again, something we're very proud of. NCQA, the National Committee for Quality Assurance, is an agency that really works with health plans to ensure we're doing our job. So the measurement is based on a few different areas. Patient outcomes, so ensuring our members are receiving their preventive exams, their preventive screenings such as mammograms or colonoscopies. So that is really a direct result of the hard work and good work that our provider network and hospitals are doing. Then it's, again, another piece of that is member satisfaction. So going back to hearing directly from those that we serve that, again, they're rating our plan highly as far as access to services, customer service, and care coordination. And then another piece of that is NCQA evaluates our operations and makes sure that we're doing our job. And again, we're the top rated plan in the state of Michigan and top 15 in the nation for Medicaid. Very proud.
And I see you received a 2019 Pinnacle Award from the Michigan Association of Health Plans.
That's right. We had a pilot remote patient monitoring program where we worked with our provider community in identifying members that this program may work for. We set them up in their homes with equipment such as a scale, a blood pressure cuff, a glucose monitor for our diabetics to help monitor their health and to make sure that maybe some recent med changes or any changes in their biometrics, if we could do something to help them to help them make some adjustments so that we could ensure that they're staying on track with their plan of care. We saw great successes, reductions in emergency room visits and inpatient stays, and more importantly, our members really liked the program. They felt maybe a little motivation by knowing that they were going to be stepping on that scale or taking that blood pressure reading, and also a little bit of a sense of a safety net knowing that somebody was watching out for them.
So what do you do to earn these awards? Why are you able to do it? What's the answer?
I would say it's in part our amazing staff that I work with. As I mentioned, we have over 150 employees at the health plan, and everyone is truly dedicated to serving our membership. And also our partnership with our providers and our community. Our providers are really providing a lot of great care and services to members. Again, people travel long distances, and to know that they can get the care they need. They don't have to wait long in the offices. That just really goes to show we have a lot of great care available locally.
Okay. Well, once again, it's a big time for people. If they have any questions about the Medicare offerings you have, they can call or go to your website and get more information.
Absolutely, and really, if there's any questions from anyone that we serve, any of our members, don't hesitate to reach out. We're always here to help.
Okay, thanks for coming in and sharing this morning.
Thank you so much for having me.
Okay, thanks. I'll be back with some more thoughts for you in just a couple of minutes. Have you thought about how much grocery shopping has changed over the years? Have you noticed that supermarkets are becoming more like restaurants than grocery stores? Let me tell you what I mean. This all came to mind the other day when I was in a supermarket and happened to notice I could buy a piece of cake for $1.50, a single piece of cake for $1.50. I couldn't help but think I could buy a package of cake mix and a can of frosting for less than $5, maybe less than $4 on a good day. Of course, I would have had to bake it, but I would have an entire cake, but that's not the story I've set out to tell. I've told you before that when I was 11 or 12 years old, I would go grocery shopping for my grandmother. I only mention it again to clearly establish that my experience with this subject goes back many years. What I want to point out is that back then, you could buy the basics, butter, milk, flour, eggs, some produce and meat. Other than bread, they didn't have many foods that were already prepared. So the other day when I saw that piece of cake, it was a reminder of how food shopping has changed. For example, one of the things we did not have in my grandmother's day was salad in a bag like they have today. You could buy a head of lettuce, a tomato, and anything else you might put into a salad, but you had to put it together yourself. You also wouldn't find potatoes already peeled, cooked, and mashed in a package. If you wanted mashed potatoes, you bought potatoes. The peeling and cooking part was up to you. And we don't have to go back to my grandmother's day to see how the food we can buy has changed. When I was in high school, we were introduced to the first TV dinner. For those not familiar with the term, it was the first complete frozen dinner in a package. There's some debate about how they came to be called TV dinners, but they did come along when many Americans were buying their first television sets and spending hours in front of them watching, including at dinner time. I know some of you will remember those early TV dinners. They came in an aluminum tray, featured some turkey, mashed potatoes, stuffing, and a vegetable, probably corn. You had to cook it in the oven, and it seemed like it took forever. Today, if you stop at a modern supermarket, you'll find aisle after aisle of freezers filled with just about any kind of meal you want, from frozen waffles to a gourmet pasta dish. And now you toss it in the microwave and it's ready in 10 minutes or less. If you go into a modern supermarket today, you'll probably find more food that is already cooked or prepared in a package or a can than you will find basic unprepared food items. And just when I thought, well, this can't work for every kind of food, I went to buy a dozen eggs, happened to look in the refrigerated case over the egg display. What did I see? A dozen eggs in a plastic bag, already cooked and peeled. I'm not sure what that says about our society. Are we too tired, too busy, or do we just not know how to cook anymore? I'm not judging, because I've used those already prepared foods myself. I do draw the line, however, at paying $1.50 for a piece of cake. A donut for 75 cents, sure, but not a piece of cake for $1.50. I'll be back in a minute. Time to wrap it up for another week. Remember, if you miss our show or want to see it again, it's available at uppermichigansource.com. It's there during the day on Sunday as a live stream and starting on Monday under the Ryan Report banner. Thanks to Melissa Holmquist for joining us this morning to provide some insights into Medicare options we have, and thank you for tuning in. Hope we can get together again next Sunday morning.